Hi, welcome to Healthy Living. Today we're going to be talking about summer safety. So I have two wonderful guests here with me today, and we're going to start our conversation with Dr. Merrill Laurent. Dr. Laurent is an internal medicine / pediatric specialist at the St. Tammany Physicians Network Clinic here in Mandeville. And we're going to talk to Dr. Laurent today about especially keeping yourself well in the summer heat and the sun. So welcome to our show today, Healthy Living.
Thank you. Glad to be here.
Glad to have you here. We want to talk about summer safety. We want to talk about keeping yourself well in the heat because we live in Louisiana. It's so hot. And I don't know about you, but I love to go to the beach, which is just as hot. So, but before we do that, tell people a little bit about you, Dr. Laurent.
Okay. I went into private practice straight out of my LSU charity training in medicine and pediatrics. Did that for 23 years, decided time to shut it down, and decided to go to work for St. Tammany because I'd been on staff at St. Tammany most of those years. And so went work in the hospital for a number of years and now have moved on to work in the clinic. And in addition to that, I've taken on the role of ambulatory quality director for our St. Tammany Physicians Network.
Wonderful. So you see patients in the clinic.
Yes.
And you also work within the system to take care of, like you said, the quality network.
Yes.
That's wonderful. So we appreciate you being here today. I got to see you in person talk about safety in the heat with Pelican Park. So Pelican Park has a lot of people who work outside all day, and Dr. Laurent was kind enough to go there and speak with them about keeping themselves well. And during that presentation, you put a statistic up there that really blew my mind. Heat is the #1 weather-related killer in the United States.
Yes.
That's a major statistic, right? So when we think about it from that lens, let's talk about what you would say to our viewers about how to keep themselves well in the heat. So first of all, what happens why is heat so rough on our bodies, right?
So there's two types of heat we deal with, our internal heat from our metabolism, digesting food, and then external heat. We think about sun, but also the studio lights, if folks work around machinery, HVAC technicians going up in attics, so that external heat. And so those two types of heat we have to get rid of so we can maintain normal body temperature for health.
Okay, so that's kind of what the stressor is on your body,
Yes.
is that your temperature goes up.
Yes.
Okay, and does that make your organs work harder?
So we lose our heat primarily by evaporation and perspiration. There's some radiates off the body, but perspiration. And that's the best way for our body to self-regulate. The stress comes when the outside temperature is about the same as body temperature or higher. You can't lose the heat comes in. And also with humidity, you can't evaporate when the air around us has so much moisture already in it.
Okay, gotcha. Yeah. So what are some of those things we look for? So talk about some of the most common heat-related illnesses.
Okay, so simple one, a lot of people get prickly heat or heat rash. The hair follicles and sweat glands might get blocked up and causes a red, bumpy, itchy, irritated rash.
Yeah.
So that happens. That's fairly common.
Is that mostly in children or adults too?
It's very often in children, but adults can get it. And it's more of a nuisance than a true health danger.
Yeah.
And it can be treated just by avoidance of the heat, some cool compresses, some lotions, a little bit of cortisone cream. If it gets really bad, it can turn into hives, and then you need to start maybe seeing the physician for some extra help.
Gotcha.
But that's kind of the nuisance heat illness. The more dangerous ones, we talk about heat exhaustion.
Okay.
So that's when you lose so much electrolytes in your sweat and you're not replacing them, you just get so tired. Your muscles just can't go. That's sort of related to heat cramps, which is also the same mechanism, but then you start having pains in the belly, like stomach ache. Also, you can have spasms. We used to call them Charlie horses,
Yeah.
you know. And the treatment for both of these is basically the same. First and foremost, get out of the heat, right? Go inside somewhere nice and cool, drink something cool, take some sips, rehydrate yourself.
Okay.
And definitely don't go back out for a couple of hours till you know you're well past it, because if you go back out, then you're at risk of
compounding it.
Yes, of the next, of hitting the next more serious ones.
So what's something a little more serious? These are absolutely precursors to something more serious, as we said, so
Yes.
we need to watch that.
So if you get dehydrated enough, you can have what we call heat syncope, just you pass out from the heat.
We kind of just talked about that,
yeah.
because I had an experience with that.
Right, and more often people who are on blood pressure medicines, especially fluid pills, that tend to make you a little bit dehydrated in the first place, those are higher risk. Babies and small children, as well as the elderly, are at higher risk for that.
Right.
And, you know, like any time when you might be a little dehydrated, you stand up too fast, you get a little lightheaded, and might actually pass out. And if you pass out and hit your head, of course, that
Another
can be
injury.
very bad. Right, right. And so all of these are when the body's working overtime to try and self-regulate and get rid of the heat. You'll see the person looking sweaty, damp, things aren't evaporating, looking tired. Sometimes folks will try and ignore it and say, oh, you got some Tylenol, I'm just having a headache, it's nothing. But
Yeah.
really, that's a warning sign. And things to look out for in folks that maybe you're doing a job with is that person who's normally can do a certain amount, carry 2 bags of topsoil mulch, right. Normally carry 2 bags per trip, is now taking 1 bag each trip just because they're feeling tired and getting run down, slowing down.
Yeah.
So those are some of the warning signs. And the absolute most dangerous version of heat-related illness is heat stroke. And so heat stroke is when the body loses all that ability to try and perspire and evaporate and lose heat. So the person becomes beet red, dry, hot skin.
Wow.
And that's very, very dangerous because in a matter of maybe 10, 15 minutes, the internal body temperature can go up very high, 105, 106. Very dangerous.
So if you're outside with someone, whatever, doing yard work or just having a good time, you know, having a picnic or barbecue or whatever, maybe even running like a 5K or something.
Right.
What is the first thing you should do when you think someone is in distress like that and maybe starting to get heat stroke?
So heat stroke, you definitely need to take immediate action.
Okay.
So, you know, we talk about when folks have an event and they pass out and have somebody call 911 while you tend to the victim, to the person.
Right.
That heat stroke, you definitely need to do that. Get 911 on the way. Get them out of the heat into cool liquid if you can, a cool shower, cool bath, not icy, because if you put somebody in ice water during that time, their blood vessels in the skin clamp down so they don't lose the heat.
Yeah.
But cool water can help transfer the heat away from the body.
Okay.
If they're at all awake enough, you can have them do some sips. Just got to be careful because those folks might pass out. And then ice packs you can do under the armpits, the neck, the small of the back, in the groin, all the places that you think of that where
Radiate heat.
get hot and sweaty.
Yeah.
Those are good places to exchange heat with the ice packs. But heat stroke is a true medical emergency, and that person really needs to get cooled down immediately.
Okay.
Because it's called heat stroke because it can cause brain damage.
Now, if you're looking at the person, they look hot, they seem, you know, they're red, they're fatigued, they just can't go anymore. Is there any other thing, like, could you ask them a question that would indicate they're in trouble? Like, what would you know to really know that it's heat stroke and they're not just, you know, say, sweating out something from the night before or something, you know?
So definitely confusion and can happen with heat exhaustion as well as heat stroke.
Okay.
So it's definitely, it'll start with the heat exhaustion when they're still sweating and very damp. But definitely if you're seeing signs of confusion, then that's
a
the next
huge
level of
red
emergency.
flag.
Yes, that's
Okay.
time to get out and get help.
Okay.
Get out of the heat and get help.
So we talked about what can happen if you get too much exposure to the heat and you get in trouble. Before any of that happens, what would you tell people to protect yourself to start with? Like, what are some best practices? I know I'm going to get up this morning, I'm going to go walk on the lakefront and, you know, help a friend get some exercise, and then we're going to go garden, and then we're going to jump in the pool. So what do I do from the time I leave my house
Okay.
and then throughout the day?
Very simple.
Okay.
Simple things that kind of it makes sense. Wide brim hat. You know,
Okay.
just baseball cap's okay, but you want to protect the whole head if you can.
All right.
Polarized sunglasses to protect your eyes from the sun, from the UV rays of the sun. You want to pre-hydrate, so to speak. You want to
Okay.
drink some water before you go out.
Okay.
You know, a bottle of water, a big glass of water, and then throughout the day, every hour, you want to drink probably about 16 ounces of water when
Okay.
it's the heat of the day. In between, you can drink some sports drinks to replenish the electrolytes as well, so it's not all water, but keep drinking all day, plenty of fluids, avoiding caffeine, avoiding alcohol, because those are
Right.
dehydrating. And you want to take breaks. You want to take frequent breaks.
Okay.
You want to avoid the 10 a.m. to 4 p.m. peak sun hours if you can, and if you can't, you just really have to be extra cautious.
Right.
And work in teams and look out for one another.
Okay.
You know, sunblock helps as far as preventing sunburn. People do that, and that sunburn can really get nasty if you have a severe one. Can turn,
Right.
you know, second, third degree burns if it's bad enough. So prevention with putting on sunblock before you go out, and then depending if you're sweating a lot or you're in the water, reapplying frequently, or using one of the brands that's made to stay on in the
Right.
moisture.
Right. They have a few that are water resistant.
Right. Yeah, and just really take your time. Don't think that you can do the same thing in the middle of August that you can do in March.
Right. And so you mentioned water and sometimes a sports drink in between. Is there a reason why you just wouldn't drink Gatorade all day?
It's probably not necessary. And I think for most people it would not be dangerous. The only folks I can really think of would be folks who have maybe kidney issues or heart issues.
So it's best to kind of do a little mix
Do a little
of,
bit of mix,
of
yeah.
fluids. Yeah. Okay.
Your body holds on, your kidneys generally will hold on to some of the electrolytes, so water, Gatorade is probably a good mix.
Okay. So I know that when my children were little, we would go on beach vacations, and I mean, I had, you know, infants to whatever, 5-year-olds at throughout many years. When you talk about an infant or a child that is smaller than an adult,
Yeah.
do the same practices apply, or is there something a little more you should do?
You have to be extra careful.
Okay.
So smaller humans have more surface area per body mass.
Okay.
So they can really get in trouble a lot quicker with losing their fluids and becoming dehydrated. So you want to definitely keep them under a canopy in the shade, limit their time out in direct sunlight, especially those peak hours in the middle of the day.
Right.
Plenty of sunblock to prevent, because, you know, my generation, we didn't use sunblock
Nope.
back in the day, and so, you know, you want to not set them up for sunburns and getting skin cancer down the road as adults. You want to protect them. So you really just have to be extra careful with the youngest of the young.
Okay, and watch for those same symptoms.
Same symptoms.
Okay.
You might, you know, if they not verbal, they might just get irritable and cry,
Right.
and, you know, you try and give them a bottle and they won't take it, or they take it and they're still irritable, you know, things like that. So yeah,
Yeah.
inconsolable,
Is it
not
safe
wetting
to say-
diapers as much is a sign. You know, we always worry about dehydration
Yes.
in little ones. If they normally have a certain amount that you expect as a
Right.
parent, and then suddenly the diapers are dry, you have to be careful.
So is it safe to say to a parent, if you think something's wrong, just take your baby to the doctor, right? In a heat-related situation.
Yes.
Okay.
Definitely get them out of the heat.
Yeah. We
Take-
just want to assure parents that it's okay to call your doctor and ask the questions. You know?
Yes,
It's okay.
it's okay.
Yeah. Feel confident in doing that.
Yes.
Yeah, good. Well, is there anything else you want to add about this topic or anything else?
I think just the biggest thing is to really take care of each other and be cautious. You know, a lot of times we're so busy during the week that come Saturday morning we got so much to do, we just try and plow through it. And I've been guilty of that myself.
Oh, yeah.
Although, you know, maybe not as much as I should be, but you know, just trying to do too many things without taking those breaks. That's important.
Okay. Well, thank you so much for being here. Okay. And if you need to reach Dr. Laurent, he is at our St. Tammany Physicians Network in Mandeville if you want to schedule an appointment with him. And thank you so much for being here and this great information. We are coming right back to talk about summer safety again, and we're going to have a special guest, Nicole Mellarine from our trauma department. So stay with us.